My name so my name is Anthony, and I'm going to be presenting with Christina and Julie about our wheelchair pressure mapping and alert system. So in this class project, we were tasked with finding a need knower and talking to that need knower about a particular health condition. We talked to a man in his late 60s to early 70s. He has a background in medicine, in both internal medicine and anesthesiology. Apart from that, he's also an avid photographer and he engages in mentorship with students. And we found out in this interview that he really values living independently. And that's despite his condition, which is that he is a C5, C6 quadriplegic with complete spinal cord injury. So that basically means that below the waist, he's totally paralyzed with his legs, and he has some degree of arm and hand paralysis as well. And this was as a result of a motorcycle accident that he sustained about 2 decades ago. When we talked to him in the interview, we covered a lot of content, but it can be boiled down to these 3 categories. The first is recovery and challenges. So he talked about pressure sores, which are these patches of tissue that degenerate based on how long that person has applied pressure on that area for. And he talked about the adaptive devices he has used to ameliorate these issues, which are mostly seat cushions, but he also is kind of dissatisfied with these devices for various reasons. And he had suggested ideas for how to improve these systems to better mitigate those pressures. And he suggested specifically like a pressure mapping system. And so from these needs, we came up with a combined need, which was that it would be great if we could have a pressure mapping system that alerts the user to change positions to prevent development of pressure ulcers. To highlight a couple points from the interview, he talked about why we as people who don't have spinal cord injuries can prevent pressure ulcers relatively easily. And that's because since we can feel them, we can move and redistribute the pressure. But people who are paralyzed or who are insensate or mentally compromised, sometimes they don't know. And he mentioned that this is a $1 billion problem in the United States. And for that himself, he actually estimates the cost of his 3-year wound care at approximately $200,000 as an outpatient. So I'll give a little bit of background about the biology of pressure ulcers as well as the different techniques used to treat them. So the first thing on the left here is obstruction of blood flow. So that means that there's a lack of oxygen traveling to those affected tissues, which eventually means that those tissues deteriorate in health. And if that persists for a long time, these patches of tissue become pressure ulcers. And although the figure on the right is a little bit complicated, the main takeaway is the shape of these curves. So these curves represent the amount of pressure that an individual can tolerate over time. And we see that these curves decrease over time. So the amount of pressure that an individual can tolerate at a location decreases over time. And usually pressure ulcers are prevented by self-maneuvers. So the person moving him or herself, alternating pressure through some device to redistribute the pressure, or in person, a nurse might turn the patient or roll them over. Just to go over a couple existing solutions that are on the market, there are some inflatable cushions such as these, which help redistribute the pressure. And in research, there are some like ergonomic solutions as well.
So just to reiterate what Anthony mentioned, along with the existing cushions, there are self-management practices patients use to relieve their pressure ulcers, such as shifting their weight while they're sitting or using the tilting function on their electric wheelchair. However, the issue is that many patients don't know when to engage in these self-maneuvers as they can't feel those parts of the body that are getting sore. Following from our interview findings and background research, we hypothesized that incorporating a pressure feedback-based LED alert system into a user's existing wheelchair setup will empower the user to self-manage their pressure relief. By signaling the need for them to engage in specific relief maneuvers, we predict that we can reduce the amount of pressure they experience in those key areas where they experience pressure ulcers, therefore decreasing the frequency and severity of these ulcers. For our proposed device, we developed a simple 3-step process for our system to sense pressure and alert the user. So in step 1, as you can see, we have an 8x8 pressure mapping grid that senses the sitting pressures that the user experiences. When high pressure is detected in specific locations, highlighted in red, an LED matrix located on the user's wheelchair arm will light up corresponding to those areas of high pressure. Once the user is alerted, they can then redistribute their weight accordingly so the pressure drops back to a safe and normative value. Here we just have a small diagram to show the device operation pathway. So if you start on the left where the device is switched from off to on, it samples the pressure grid to sense the pressure data. If there is no pressure detected for a continuous amount of time or a peak instantaneous high pressure detected, we just wait until we need to sample the next pressure data. However, if there is a continuous or instantaneous high pressure detected, then we light up the LEDs to sample and alert the user. So we sample these pressures, and then when the user redistributes their weight, we then sample to see if the pressure drops below this certain threshold and dim the LEDs. For device design, we have a multi-layer textile sensor. So in this fabric pressure sensing sensor, we have 3 layers. The top and bottom layers are conductive fabric, and a middle layer is sandwiched in between. That is a pressure sensitive fabric to be able to detect these pressure distributions. We have a 1.55 square inch resolution, which means that each square in the pressure grid has that area, and this is enough to be able to detect most pressure sores. This is also a really unique idea since it is integrated in a fabric and can be integrated with many different cushions available. For a device setup, we have the LED display, as I mentioned before, resting on the wheelchair arm, and a battery box and electronics box attached to the sides and underneath the wheelchair seat. So it is easily adaptable to many wheelchairs of different types and sizes. This is a very non-invasive way to measure pressure, as the pressure mapping grid is just seated on top of the wheelchair seat. And we also have a method of data collection and storage via SD card.
As Julie mentioned just earlier, this device is incredibly portable, which gives us a really big benefit when we're trying to test our hypothesis of whether it's effective in allowing users to actively respond and learn from these alerts. Because in this way, users will be able to bring this device into their homes, and we could test how they utilize it throughout their daily lives. But their response to the alerts is only as useful as their ability to self-manage and to know where they should redistribute their weight. So during our study, we're going to explore the user's response while they have alerts, as you can see in this chart below on phase 1. And then we'll collect pressure mapping and distribution data to see if their pressure distribution betters and prevents pressure ulcers. And in phase 2, we'll actually take away these alerts to see if they have sustained long-term learning in terms of their ability to know when is appropriate to self-manage their own pressure relief. And as a control, we'll take one group and provide them with this pressure mapping system a little bit earlier, but with no alerts, to ensure that the differences in pressure distribution aren't just due to the mat itself without the alerts. So moving from there, we have to ask the question, why is this important? Like, why should we really explore this question? And so it's because the cost of care can be really, really high. The cost of care for one pressure ulcer can be up to $151,700, and that's a massive number. And keep in mind that this is per pressure ulcer, and someone can get multiple pressure ulcers over time. So when we're looking and exploring from that, a lot of people, they have pressure ulcers and they get treated for pressure ulcers, and that's a really big deal. But moving from there and moving forward from there, a pressure mapping feedback can really help enhance a user's experience when it comes to preventing pressure ulcers. So pressure mapping feedback can not only alert, but it can also allow total prevention of pressure ulcers in the future with more devices and study and research. So some instances of broader impacts and why this matters is kind of what we discussed in our research study about wheelchair pressure relief applications. So that could come in the form of self-management or in terms of physical therapy. So for self-management, users can, again, readjust their positioning to relieve pressure. And for physical therapy and for rehabilitative purposes, users can kind of see when they first are influenced by spinal cord injury, or even if they've been living with it for a while, how they can more easily mitigate the risks and side effects that come along with it. Another avenue of impact is our pressure data distribution and data applications. So for instance, when we're looking at things such as hospital beds, people who are, for example, in a coma, or if they go to the hospital and they're bedridden and they have limited mobility, they can be laying in bed for many, many hours. And so even if they are able to feel, these pressure ulcers can still be developed. So as mentioned earlier in our presentation, nurses have to come in and turn the patients to actively move them so pressure is relieved. And in addition, within the clinical setting and within hospitals, things such as long surgeries also have very similar impacts. So if someone is on the operating table, they go in to get a surgery for one health condition. Even if that surgery fixes that health condition, if they're laying there on the operating table for a really long time, they can develop pressure ulcers, and they can leave that surgery with another condition that can still put them at very high risk of infection and deteriorating health. As well as within the medical community and outside the medical community, such pressure sensing systems can be applied to aspects such as gait analysis and other industry aspects that can deal and help benefit overall posture and well-being of patients. So as we can see, this really has a huge impact on not only people within our own medical community and within our society, but across the world.